Today, I took action to lift some of the restrictions on the Stay Home, Stay Safe order. I signed an executive order to allow some previously suspended forms of work that are lower risk for COVID-19 exposure so that they can resume on May 7th. That includes construction work, real estate activities, and work that is primarily and traditionally performed outdoors. My public health team will be monitoring very closely to evaluate the effects that these activities, that the effects of allowing these activities have on our public health. And I want to be clear, the Stay Home, Stay Safe order remains in effect until May 15th.
It does indeed. It is in effect. Things are complicated, but we are getting through it each and every day right here in Oakland County. We're getting through it because we're working together, you and I, the first responders, the folks at the hospitals, the elected officials that are so hard at work every day, providing the community services that you need to get through this difficult time, employers, golf course operators, folks that launch your boat. I mean, everybody, we're all working together to get through and figure out how to navigate these very complicated waters as we start to open up our economy and try to do so in a safe way and in a way that will that'll help get our economy back on track. We got our hands full. So this is the Megacast. My name is Dave Scott. Thank you very much for tuning in wherever you happen to be. Our daily broadcast runs from 10 o'clock in the morning till 12 noon live, and then on many of our outlets, it's repeated throughout the day. So this is not a radio show. It's not simply a radio show. It is a radio show, but it's not simply a radio show. It's not simply a television program on cable TV. It's not a streaming show only. It's not a podcast. It's all of those things and more, and it is here for you each and every day. I want to thank the Greater West Bloomfield Cable Communications Commission for making all this happen. That's who we work for in the West Bloomfield and Lakes area, and it's their facilities that we are sitting in at our Lakes FM studios, 89.3 Lakes FM, on Walnut Lake Road in West Bloomfield. We are on Civic Center TV, Channel 15 Comcast, Channel 99 AT&T. But that's not it. We're also all across Oakland County, and that's what makes us so special. So a huge thank you to the Birmingham Area Municipal Access folks at Have Us on Channel 15 Comcast in Birmingham, Bingham Farms, Beverly Hills, and Franklin, and also on the Bama, and do they call it Bama? I think so. B-A-M-A, Bama website. So you can go there, too, and Google that and find that. We are on some incredible radio stations, not only our flagship Lakes FM, but also on 88.1 WBFH The Biff, broadcasting from Bloomfield Hills High School. And we want to thank Ron Whittable there, The Biff, who is runs that operation, and the whole team over there, and our good friend Pat Watson, the relatively new superintendent of schools in Bloomfield Hills, for making the broadcast possible. Also, a big shout-out and thank you to WAHS 89.5 Avondale Community Radio. Student Logan there gets us on the air every day. He's a junior, making a big difference in the coronavirus world. Logan, we thank you. We also thank Dr. Schwartz and everybody at the Avondale School District. And today, looky here, Tyler. How about this? The West Bloomfield School District is our Facebook partner. So every day we have a Facebook partner, and then we broadcast the show to Facebook Live. So today, that is the West Bloomfield School District, and that is a great school district with a lot of fine people. We're going to meet some of them this morning, but also a huge following on Facebook. But Tyler, I tell you, as Tyler Keefe comes in our studio, our co-host for the show. Good morning, Tyler. How you doing?
I'm good. How are you?
I'm good. But, listen, as great of a school district as West Bloomfield is, and as many followers as they have at West Bloomfield, they're going to really have to ramp up. Everyone's going to have to get on social media today and call out everybody to let them know that Assistant Principal Ashley Larkin is going to be on here in just a couple of minutes, because Oakland University, amazing, 27,000 people watched our broadcast when we had the Oakland University Facebook partnership going last week. How about that?
Yeah, it's incredible just the amount of people that we were able to reach with that show, and we had a lot of good content too from Oakland University as well. Talking to President Ora, talking to Joe Young, so really good lineup as well.
Do we have any more of these disinfectant
I
wipes?
have to take a look.
I don't, because now I'm down to the last disinfectant. I'm going to have to do this because,
Oh no,
but I just knocked my headphones right off here. Forgive me, but
it's all right.
that is the absolute last disinfectant wipe. We've
man.
done a month of shows, and we want to make sure we keep the place clean every day. Thank you for putting up with all this. I understand this doesn't make great television and radio. But this is coronavirus time, so part of that is making sure you're keeping your social distancing. You're wearing a mask when appropriate as you're out and about, and more of us are doing that. And that you keep your surfaces wiped down and you take care of all the things, because we cannot open our community, our society here, without doing all those things. So just a note, Tyler, the absolute last wipe in the Clorox disinfectant wipes container, when you get down to the last one, it's like really, there's a lot of sauce in there when you get right down.
Yeah, I noticed last week I wiped down over here with one of the last few of them.
Oh,
and it was,
man.
Yeah, man, we had the disinfectant on here for at least 45 minutes after.
All right. Well, patiently listening to all this and wondering what she got herself into is Ashley Larkin, the assistant principal at the West Bloomfield High School. Assistant Principal Larkin, good morning. Thank you for joining us here in the Megacast.
Good morning. Thank you for having me.
Forgive us while we, clean up the studio a little bit. Who knows who was in here over the weekend?
No.
She appropriately has no comment. That's why you're that's why you are the assistant principal at West Bloomfield High School. Thank you for joining us. It's good to have you with us, and it's really great that you're participating with us on Facebook. So we're glad to have you. Awful lot has gone on over the past month or so since we started this. Whoever would have known that one day a light switch would go off and you'd be sending all the students home, and they'd be learning from home, and big change for teachers, for students, for parents, for administration. How's everybody doing making all the adjustments?
We're doing fairly well, I think, considering the circumstances. It definitely was a little bit of a shock to the system. I will say, though, that I'm super proud of our district, our teachers, our staff, our administrators, our students. We took one day to really prep for online learning, and that next week is when the governor called school off. So we were definitely prepared to roll out online learning, but that doesn't mean there aren't challenges associated with that. It's definitely a new normal for everybody that we're working to navigate.
Are your students and teachers getting better at it? Have they learned things over these past several weeks, some new strategies that will be helpful going forward?
Yeah, I think we've definitely put time into learning new strategies. A lot of things the first couple of weeks were trial and error. Most of our teachers have never been on Zoom before. And so that was something brand new that we had to navigate. Using Google Classroom to post different lessons, doing screencasts to record themselves lecturing or to record notes. And then students are really engaging with it well. I think we were at a benefit because our students are already very tech savvy, but not being physically in the building and learning one-on-one from the teacher, I think presented some significant challenges. But most of them now are rising to the occasion, and any that need help, we're definitely supporting through it.
Ashley Larkin is with us. She is the assistant principal at West Bloomfield High School, joining us today on the Megacast via Zoom, and assistant principal Larkin. So we're coming to the end of the school year. I don't think anyone has any false hopes of a school opening again, but do you think districts, and including West Bloomfield, will look at some enhanced summer programs and other things that we might not normally have embarked on during the summertime?
Absolutely. We have been looking at some enhanced summer programs that would be optional. We're also offering a virtual summer school. So we're offering a variety of courses for students to take, both elective and core classes, so that they can advance their academics. We also have virtual classes that will be running through a platform called Edgenuity, and those would be for grade improvement or credit recovery, and also to refine skills. And then we're hosting a variety of student sessions throughout the summer with the counselors, just to refine some skills in terms of potential test taking, if standardized testing is even an option next year, as well as applying for college, and some different things to refine the academic skills, like writing essays and those types of things.
Yeah, we have a lot of thoughts. We're thinking a lot about all students, everything they're going through, and in particular, graduating seniors. The challenge this must be for them. I know you're working on a program to have a commencement ceremony so they're properly recognized. That is a challenge in and of itself. I guess we could talk about that. But in addition, the universities around the state of Michigan have all reached out to every student who's graduating this year to say, hey, look, we care about you. We know it's going to be difficult, but communicate with us. If you don't have all of the testing that you normally would have in place, don't worry about it. I assume you saw that communication from the universities, and has that been helpful for graduating seniors?
Absolutely, yes. Most schools at this point, most major universities, we're still waiting on a couple, U of M being one of them, but most have gone test optional at this point, or are refining some of their requirements for students that might be applying even for next year. And so that, I think, has definitely helped ease some of the anxieties for our seniors.
And, we had great leadership from right here in Oakland County. Oakland University got out in front of this big time.
Yes.
And what a great job they've done. They announced already their plans for the upcoming school year. And that's got to be helpful. And maybe some things will need to be adjusted. But how helpful is it that's going on? And I assume you're getting similar feedback and information from the other universities.
Mm-hmm. Yeah, that's definitely helpful. I think, one of the biggest sources of anxiety for everyone, and especially our students, is the unknown. So I think the more that information comes out, the more helpful it is to, work with them to navigate those challenges.
Joining us via Zoom from who knows where, we'll find out in a minute, Ashley Larkin, the assistant principal at Westmoreland High School. So where are you, Assistant Principal Larkin?
I am currently in my basement at my house. I apologize if you hear a little one screaming upstairs. I do have a 20-month-old who's running around up there.
No, that's kind of the beauty of this whole thing. It's all right. It's cool. That's been fun. I've been enjoying meetings in people's living rooms and kitchens and kids running around, and it's just kind of that's part of the new normal. So we understand. I've been told that there are some new health and wellness programs for students and staff during these challenging times. Would you elaborate for us?
Absolutely. So I think one of our main priorities first, before even the academic piece comes in, is the social emotional piece for both our staff and our students. And so for students, we are making sure that we're really providing them with a variety of programs. So the first thing is that our teachers are putting wellness checks on their Google Classroom accounts. And so those occur every day. So they might ask students questions like, how are you sleeping at night? Are you still connecting with friends? Those types of questions, just to gauge how they're doing. We're running a program Monday through Thursday called Coffee with Counselors. And so the counselors are hosting 1-hour Zoom meetings where students can log on to get some social emotional support, talk about some of those questions you were mentioning earlier, like college, and some of the things that might be causing them some anxiety.
That's cool, because I don't know about you, but when I was in high school, I wasn't allowed to drink coffee. So, the kids drink it. They probably drink coffee like crazy.
Oh, yeah.
Do they?
Yeah. We have the Keurig machines in the ice center.
Hold on, Tyler. Are high school kids drinking coffee?
I guess they are. I have seen the coffee machines in the ice center at West.
All right. So you have coffee machines in the ice center then? Is that what you're saying?
We do, yes.
All right, cool.
Students can bring their own pods or purchase them and make their coffee in the morning.
All right. Well, I guess it's just a sign of the times. I'm dating myself. So that's cool. So you have these coffee programs, and they're really not about coffee. They're about getting information to the students. I interrupted you. Is there anything else that you wanted to share with us?
Yeah, the other two major things, we're doing formal wellness surveys every 2 weeks so that the counselors can really gauge where students at and then determine if they might need some one-on-one support. And then the last major thing that we're doing is we're running student yoga through Zoom. So every Tuesday and Thursday, we host a 1 hour yoga session for any students that want to log on and participate.
I love it. I saw some really interesting video over the weekend of some physical education educators doing their thing via Zoom, and you think of all the different things that you would think would be difficult to do in the virtual space, but it was really cool. They figured it out. It was great, and and it was working for everybody. So glad to hear that's going on. So we're on your Facebook page right now, and I know this from the Oakland University page the other day. The president of Oakland University, when we were on their page, made some big news, started talking about graduation, and then everyone checked out the Facebook page. So do you have any secrets that you want to share with us that are going on in West Bloomfield schools that will blow up our numbers on your Facebook page?
Oh, I don't know if I can reveal all the secrets yet, but I will tell you that we definitely have plans in the works. It is very important that we're honoring our seniors. We've already started doing that in a variety of ways. So the district is putting out these wonderful senior profiles on Twitter. Last Friday, we just had college signing day. May 1st is the National Decision Day. And so our students posted with different hashtags like I decided or life after Lakers. And said what their plans were for next year. So we had great participation in that. In terms of graduation, we obviously are planning to hold some type of graduation ceremony. It's very important that our seniors are honored for all of their hard work throughout the years. We're looking at a few different options. I think all of us are pretty aware that where we're at right now, I don't know that we can foresee a standard graduation ceremony with everyone in attendance in the stands and all of the students sitting in their seats. But we're looking at some potential virtual options, as well as potentially like a drive-in setup. Some schools are doing a parade style graduation where they have cars line up and then they get their diploma through their car window. So there's a lot of different creative ideas that are being put out there. But I think the most important thing to know for our seniors and for the parents and guardians of our seniors is that we are going to host some type of graduation ceremony to honor all of these students.
I love all those ideas. I like the drive-by graduation. That sounds like a fun one to me. But there are challenges and all those things, and I know you'll come up with the right solution. I've been telling people that are looking at virtual things, because that's really what we're doing here every day. We're doing virtual television and radio through Zoom and other resources. I just tell people, look, Saturday Night Live pulled it off, and the NFL had the highest ratings ever when they went virtual with the draft. People will figure it out. We're all getting better at all this, so I'm sure whatever solution you come up, the seniors will appreciate it, and we just got to get creative and pivot, and we'll figure it all out. I love the parade idea. That's really cool. So good luck with that, and maybe we can be of some help along the way. We'll have to see.
Thank you. That'd be great.
Ashley Larkin, Assistant Principal, West Bloomfield Schools. Anything else you want to share with us today?
I thank you for having me on. I think it's so important for everybody to remember that health and wellness and social, emotional, feelings for our kids come first before the academics. Academics are important, but we've got to make sure that everybody's in a good place in order to learn. And so we're happy to support both our students and our staff with a variety of social emotional programs. And we're going to get through this. We're experiencing a new normal, but if we work together, we can definitely navigate everything that we're going through.
Yeah, you and Pace picked a great time to just to move in and do this thing and have a change of administration there at the high school. So it's like here we go. But hey, you're doing a great job. Congratulations. Thank you. Ashley Larkin, Assistant Principal, West Bloomfield High School. Say hello to Principal Pace, and we look forward to talking to you soon.
Will do. Thank you so much.
All right, there you go. Ashley Larkin checking in from West Bloomfield High School. Seems like she's got things under control there, Tyler, in our schools. We continue to talk to our superintendents and administration from our schools around our area, and it's just every time we get somebody on the air, we find out something new and learn something new. And I love the parade idea. What do you think about that?
Yeah, I think it's an interesting idea. I've seen some videos on social media of other school districts in the state and throughout the country that have had their special way of honoring their seniors, still having that interaction at a safe distance and in a safe manner between the students and the educators, but also engaging the community in a way that still makes the day special, even though it's not what the students would necessarily expect to get from their graduation ceremony.
Well, no, and to our affiliate radio stations and to our team as well, a parade would go hand in hand with the radio too, because if you're in the parade and you kind of want to hear what's going on at the other points in the parade and all the communication we could do over the radio, so that might all work hand in hand. What do you think?
Yeah, and it's a great way for people that are maybe still a little bit afraid of going out and being on site for a parade like that, or members of the family that aren't joining because they're following social distancing guidelines, to still be able to participate in some way.
Yeah, I mean, and we got to be careful. We're not going to have a parade in the conventional sense any day soon with people lining up along the side of the street, but I'm sure they will come up with a creative solution, and for all of our schools, we're on board. Let us know how we can help with our radio stations. Hey, we're going to take a quick break. Dave Scott, Tyler Keefe will run down the headlines we have today on the coronavirus front here in Oakland County and our communities. And then we're going to talk to our own version of Dr. Sanjay Gupta. It's Dr. Jamie Taweel. He is standing by. Look at him smiling. He likes it. You like that reference to Dr. Gupta. So we'll talk to him in just a couple of minutes. Don't go anywhere. This is the Megacast.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Well, good morning and welcome back to the Megacast. We are live from 10 to noon every day on many of our stations. And if you're watching this or listening to this in some other hour of the day, we thank you for tuning in, and we invite you to tune into the live edition of the Megacast. I broke out the Disney mug. I thought that would cheer things up for today, Tyler. We'll see how things go. Was it a great weekend or what?
It was
unbelievable.
Such a great weekend. It was really nice out both days, Saturday and Sunday. It's beautiful.
So thank you for joining us on the Megacast across much of Oakland County. We are on Civic Center TV and Bama, Birmingham Area Municipal Access, Channel 15, Comcast, Channel 99, AT&T in many of our communities. If you got AT&T, you can watch us virtually anywhere. If you can't pick up one of those cable channels, go to civiccentertv.com. You'll find our video player in full high definition. And we thank you for tuning in on our great radio stations. WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, and of course right here in our Lakes FM studios. Thank you for tuning in. 89.3 Lakes FM. That was the dorkiest thing I've done yet on television when they just tried to point to the sign. So I'm a radio broadcaster. So headlines, folks. Let's go to our webpage and take a look at what our incredible producer has assembled for you as the top stories today here in the Oakland County and Lakes area. Oakland County funds manufacturers to switch production to medical equipment and PPE. Story goes on to say 6 manufacturers will share nearly $350,000 from a fund approved by the Oakland County Board of Commissioners. Dave Coulter told us about this late last week. These manufacturers include Oxys America, Connection, Polyflex Products, Signorama, Acme Mills, and RPB Safety. Congratulations to all those companies. They are pivoting. They are making the difference. New contamination device ready to sterilize N95 masks for reuse in Michigan. Now, we can pick on the president about a million dumb things he said on television, but didn't he at one point say, hey, look, I think we can clean these masks? And everyone said, no, that's impossible. So, You know, he got that one right. New decontamination device. A decontamination device was sent to the TCF Center, downtown Cobo, that can decontaminate N95 masks, making them reusable up to 20 times each. Well, that helps solve a big problem. We don't have enough N95 masks.
Yeah, being able to reuse them is gonna make getting a new population of N95 masks out to the frontline workers even easier and more efficient, because you're not going to need as many to be produced, so you can produce more of them at a faster rate and get them out where they really need to go.
That story on civiccentertv.com/coronavirus. Here's somebody with a creative idea. I don't know how practical it really is, but I'll share the story with you. Oakland County man builds drive-in theater to safely hang out with friends amid the outbreak. Troy resident David Tracy spent only around $100 on setting up a backyard movie theater to hang out with friends and neighbors while adhering to safe and social distance practices. Well, David, I'm not so sure that you're following all the laws and rules, but that was reported on Click on Detroit. Can you have friends over to your backyard right now? I don't know that you can do that.
That seems like a little bit of a gray area.
Yeah, and I don't know that you really can play a movie without getting the rights to it and bring up the whole neighborhood over. But you know what? What the heck? That's what he's doing. David Tracy, you're making an effort. We'll figure out, we'll call the lawyers later and figure out how to make it right. Now, the governor did shut down that one drive-in movie theater operation in Lake Orion because all movie theaters are shut down. Is she going to shut down David Tracy? I don't know. We'll see. She probably doesn't know about it, just in his backyard. GOP lawmakers say they have another weapon in the fight with Governor Whitmer money. GOP lawmakers believe they have a new program, a new weapon to garner a greater role in the decision-making. There's been the fight between the Republicans and the governor, you know that. That weapon being more control over the state's purse strings, which is typically the way any legislature exerts its influence. No big surprise. That's a great story if you want to read the details on that story. It's from Bridge MI. And if you're looking for a really nonpartisan source of information around the state of Michigan, they're a really good one. We link to a lot of their stories, and I hope you check that out. And I'm sure that will not be a partisan report on what is a very partisan activity. So go check that out. Federal government allocates $11 million to Michigan public housing amid the coronavirus pandemic. The U.S. Department of Housing and Urban Development is spreading out about $685 million in relief funds to help public housing authorities. Now, here in Michigan, the Michigan Public Housing Authority, $11 million in funding. So that should happen. A couple more stories, and we'll get to the doc. Few coronavirus cases, lots of land. Should northern Michigan reopen? So we have not yet seen a definitive plan from anyone, governor, legislature, but really it's got to come from the governor, to open up portions of the state and leave other portions of the state as is. A lot of discussion about that. I wouldn't be too surprised if we hear something from her over the next week or so in that regard. Here's a story on our website. Areas north of Bay City include almost half of the state's counties, over half of the state's landmass, but only 9.2% of the state's population and less than 2% of the COVID cases. So that's out there. The pushback on all this is, are there hospital beds there available should there be some challenges? So that discussion and debate will go on. Michigan Voter Information Center, Civic Center TV, and Lakes FM want you to visit the Michigan Voter Information website. You can go there and find out if you're registered, if you're in the right community. I just moved. That would be helpful to all of us, and myself included, and maybe you. And finally, don't forget we have the Oakland County coronavirus cases by zip code linked right off of our website. You can go to your zip code, plug it in, and find out how things are right where you live. So that is a summary of the top stories today. You'll find all that and a ton of other useful information when you go to civiccentertv.com and go to the coronavirus page. We invite you to do that as soon as possible. So patiently waiting through all that. Now we see him on Zoom is Dr. Jamie Taweel, internal medicine specialist and a regular to help us sort out all the medical issues here during the coronavirus. Dr. Taweel, thank you very much for joining us today on the show.
Thank you very much for having me.
You're very patient and waiting through all that. You look very much like a doctor. You know, you got the stethoscope over your shoulders. That is the quintessential doctor look. You're looking good there, Doc.
Well, appreciate that. I was seeing patients today, so I did have the stethoscope, and I have to sterilize it between each patient, and so it's been an interesting go of things.
It isn't easy, and the hard part of all this, it was easier maybe the first week or two, but it gets harder every day. Do we have to? Oh, we got to do this again. Like, we cleaned our studio up on the air as we always do, and we're down to our last Clorox wipe here. We're gonna have to get some more. It's hard, but you know what? Small price to pay all the things that all of us are doing, and you just gotta remember. Just think of your grandma, or just think of somebody else that may be more susceptible to the coronavirus, and everything we're doing is saving their lives, right?
Absolutely. You get that last Clorox wipe. It's got that extra. I heard you earlier saying it's got that extra sauce on it. Goes a little bit more of a longer distance, so to speak.
Yeah, I mean, it's downright juicy down there. I mean, all of the moisture from the wipes must get right down to the bottom, Tyler.
Yeah.
So, tell us about these new treatments and anything new that you're seeing in the field to help combat this terrible disease.
Well, the new treatment that's coming out that everyone's talking about is the Remdesivir, which is the antiviral that's I believe, originally used for Ebola and SARS. That's been showing a little bit of promise with regards to the treatments and how it's affecting, how it's reducing the length of sickness for hospitalized patients. And FDA had just recently approved the release of, or the emergency use of Remdesivir for patients that are hospitalized with severe cases. So that is a benefit. The studies are a little bit mixed, and there's still more things that are coming out with regards to that. But from my personal review of things, it looks like it's been shown to shorten the time of illness, kind of like Tamiflu would do for the flu. I don't know it necessarily has enough data to support that it will reduce deaths, but it has been shown to be a little bit of promise, at least to get us in a good direction. So I think things are starting to move, hopefully, to help at least, if anything, reduce the amount of illness to then get patients out safely and free up more resources for further patients that are getting ill.
So with these medical tests, Dr. Taweel, what are you looking for? What is the medical community looking for from these tests to ensure that these possible treatments would be effective for treating the coronavirus or other diseases?
So I'm not quite sure exactly what you're asking. Are you talking about the tests for coronavirus or the studies that are used for the treatments?
The studies for the treatments, my apologies.
The studies for treatments, what they're essentially doing is they're doing a randomized controlled trial. So they're taking patients that have been given this medication versus patients that have not been given this medication, and they're just watching the outcomes. They're not telling which patients who got what. They're double blind, so the patients that are receiving the medicine don't know they're getting it. Patients that are getting placebo don't know what they're getting, and then they just monitor outcomes to see whether or not there's been some benefit. So and then they have to reach what's called statistical significance, that enough of this has been shown to develop a pattern that is statistically significant, that it is a believable study, as opposed to a study that is not, essentially going to give us enough information that more treatments need to be done. So
I saw really good news that Remdesivir is going to be offered, I think it's Holland Labs, it's going to be offered free. So that's really helpful. I mean, what a really cool thing to do. You got the drug, and then you're passing it out for free right now. I thought that was a beautiful move. So
yeah, I believe if I read somewhere that the company that creates the drug has basically donated all of it, or at least gotten rid of its entire supply in an effort to try and treat things. Again, with the FDA approving it for emergency use, now hopefully we'll get a little bit more broad use of it. The studies haven't shown any adverse effects to it. So, it's not something that's going to be causing significant amounts of bad things, and we're going to get a little bit more of a controlled study for it. And hospitalized patients are the best ones because we have confirmed cases, and we're not just using it randomly on people that have, blank symptoms.
So Remdesivir is a therapeutic. It is not a vaccine. So we got therapeutics that help people while they have the disease and make it easier to treat and help them. And then we have vaccines that will prevent the disease. I also saw some really promising news over the weekend on CNN that there's a UK group that is making really good progress on a vaccine. They said they had the vaccine already in progress, so they had done a lot of testing to make sure it was safe to deliver. and they're very optimistic. I mean, no one knows of these vaccines, but there seem to be, in addition to what's going on here in the United States, some real progress being made on vaccines around the world.
Oh, yeah, I think it's a worldwide effort to try and get this as best treated. I mean, I think everyone on the planet has some skin in the game, so to speak. So I feel that I think a vaccine is going to be certainly going to be on the horizon. My personal belief is it won't come out as soon as we're all hoping it will. I think it's going to be some time. It's a process, and it needs to be done the right way. I mean, it's something that every single person will get. That's and so it's going to take some time, and there's going to be a lot of trials. And there's going to be a lot of different companies creating vaccines all at once. So hopefully we can just get something sooner than later. But let's just hope that we get it within the year.
That'd be great. The optimist in chief said that we would. The optimist in chief last night on his nationwide broadcast, he said by the end of the year. I don't think I've heard any medical professionals say that, but listen, I'll take some optimism. Let's just see where we end up, and hopefully we'll have something soon.
Hoping for the best.
Yeah.
Hoping for the best. And I think it's going to be a long time. It's going to be longer. Even if it's tomorrow, it's going to be a long time.
No, I get it. So now, Dr.
Yes.
Taweel, we're kind of in a tough spot. So we're starting to open up. We're starting to open up our society a little bit here in Michigan, and elsewhere around the country, they're doing it more aggressively. I assume the medical community will be watching really, really close to see what happens with the metrics as we start to open things up. And I just urge everyone in our area to do everything they can to put those face masks on when they're going out, social distancing, wash your hands, all the stuff. But we got to keep a close eye on this. Do you have any thoughts on that whole issue and what might happen? No one knows what's going to happen, but just any thoughts on the caution we need to exert while we're working on coming out here?
Well, I think we're gonna certainly get a bump in things without a doubt, and this is going to come in waves. It's not going to be this peak and then steady decline. I think it's going to be something that we're going to get more. We're going to get bumps. We're going to get peaks and valleys. And it's going to be a bit of a roller coaster, unfortunately. And I think that people will start to really tighten their social distancing once this starts to happen, and start to realize that they can't just be so lax in how they address this type of thing. I think, of course, maintaining social distancing, wearing the mask in public. I'm reopening my office, and we're putting the plan in place. I have patients that are slowly starting to come in. I'm booking them further apart. We got a big whole sterilization breakdown thing, how we're going to have to take the room and completely clean it before we get the next patient in, and we have to close the waiting room. I mean, these are things that patients are starting to have to wait in cars sometimes in an effort to try and to be seen. It's just, these things are a little bit tough. So I think the gradual reopening is, personal opinion as a medical professional, perhaps a little premature. I understand there's various factors that are really pointing to different directions as to why they should open this up sooner. But we're doing the best we can with what we have. So I'm fully,
Dr. Taweel, I appreciate you sharing the story you just did a minute ago about all the things you need to do to get your office open, and we're hearing about that. We've certainly heard the plea from physicians and from surgical centers that they want to get back to doing some of the elective surgeries. People have been waiting in line. They need that medical care, and not the least of which it also impacts their financial ability to continue to do the other things. So you just shared how complicated it is to get your office open. Do you think it's also going to be complicated to get the surgical centers open and get hospitals back in the business of treating non-COVID-19 patients?
Yes, simply put. For surgical centers to open back up and things like that, they're going to have to screen every patient that's going to get an elective surgery, because one positive patient can contaminate an entire surgical team, and now the whole team is out, or the whole facility is going to be under. These are things that really can monkey wrench an otherwise very smooth. Surgical suites, hospital surgical centers are such smooth running operations, and so one little thing that's going to just get in the way of that can really, really throw it all apart. So every patient that's going to get an elective surgery and every employee has to get screened going in, and self quarantine. If any positive, self quarantine until any positive screening, self quarantine until positive tests are either confirmed or denied. It's going to slow things down. It's going to definitely also, those surgical centers are built on efficiency and quick turnaround time, and are very, very efficient, all the while being completely safe. So now they have to do this even more so. Now, granted, surgical centers are also to begin with, big on contamination. So they're going to be sterile environments. So, but at the same time, they have to just make sure they're not going to bring in someone that could potentially be asymptomatic with positive COVID-19. So it's gonna grind it down a bit.
Dr. Taweel, anything else you want to add today? I just appreciate so much you coming on the broadcast as often as you do it. You always have something helpful for our audience, and again, you did today. Anything else you want to add?
You always ask me, and I always keep completely blank.
No, that's quite all right. That's because we got to it. We talked about an awful lot today. So
stay safe. And I would just say, I would advise everybody to just be as patient as possible. I mean, specifically, I'm using my own office as an example. It's slowed things down considerably. I spent all weekend, we were hanging plexiglass to make sure that everything is, people are in their bubbles, and please be patient.
All right. Well, it's a new normal. We got to be careful. I think it's great that you're opening your office. I mean, you could have not done that, and all the extra effort that you're going through is greatly appreciated, because you can't treat everybody via Zoom, right? I mean, you got to get them in.
And that's tough. And I do have patients that I want, we do offer testing. So I want to be able to do that for my patients. I don't want to just keep sending them to urgent cares and things like that. They want to be able to come here. I know them very well and do it. And agreed, the telemedicine visits are very, very helpful for certain things. I think that's going to probably stick around to a degree. I think patients and physicians, some of them do like it. I personally prefer, hands-on medicine. I like to be able to be in the room with the patient, even though I'm, got the mask on and the gloves, and it's a bit of a nightmare. But some of the things you just need to be able to see the patient. Nothing beats a physical exam as far as I'm concerned.
So are you and other physicians doing COVID-19 testing in your own office? Is that what I heard you say?
Yeah, so I'm working with local labs that offer the test. So now I'm able to get the testing, get both the antibody testing as well as the nasal swabs, and send them out and get my results within a day or two. So I'm able to offer testing through labs.
And is that happening widespread, or is this something that you have been able to uniquely do? Could you talk about that?
No, it's getting a little more widespread. Most urgent cares now offer it, so it's able to, as most labs now have the technology, they started to get a little bit more on board. Local labs, that is, they're able to contract with local facilities. So most of the local places should probably be able to get it taken care of.
And for you to have a test with one of your patients, what are you looking for from them? Are you now in a position where you could just test anyone who walks into your office?
No. The governor basically allowed for certain types of testing for certain people, in terms of people that don't require any symptoms to get tested, like food service workers, healthcare workers, things like that. People, basically essential workers. But if a patient comes in and has very, very specific symptoms that are going to be, cough, shortness of breath, fevers, chills, things like that, then we're going to be able to we're going to be able to test them, or known exposures. So if you've been around someone, or you're at work and you had someone that had an exposure, anyone that's going to benefit from knowing their results so that they can self-isolate and not spread this further.
All right. Well, let's keep in touch. Thank you very much. Do you want to share your information? You've been so kind. I've not let you plug your practice here. You want to give people your telephone number or your website or anything?
Of course. I'm grandrivermedical.com, all one word. And the phone number is 248-264-6169.
All right. Hey, I'm getting pretty good with my head thermometer. We've got one of those here in the office. I pass the test every time, but we're using that every day, and we were able to get one, which was amazing enough. So,
we're doing it for every employee that comes in every day.
Yeah.
So
we're doing our part. Thank you, Dr. Taweel. I really appreciate it. Thank you for joining us again today.
Thank you so much. Have a great day.
You too, Dr. Jamie Taweel joining us. That's very helpful to know that right in the front line, Tyler, we are seeing more testing. Good news.
It is. It's incredible news, because the more testing we have, the better idea we have of the numbers. The more we know from the COVID-19 testing, who has the disease, who has the virus, and where has it potentially spread from them, or how did they possibly get it. From the antibody testing, we have a better idea of what our herd immunity looks like in the community. So it makes all this information so much more available to us so that we can make more informed decisions about how to gradually reopen and what are the best practices going forward to prevent a second wave or a third wave and so on.
All right, we've spent a lot of time in the western side of Oakland County today. We're going to go at least a little bit east in a moment. We talked to the city manager of Birmingham. Joseph Valentine joins us in just a moment. After this quick timeout, this is the Megacast. I'm Dave Scott. We'll be right back.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
And welcome back to the Megacast. Dave Scott, Tyler Keefe in our Lakes FM radio studio in West Bloomfield and all over the area on various community television and radio stations. We thank all of them, including Civic Center TV in West Bloomfield on Channel 15. Birmingham area, Municipal Access Channel 15 in the Birmingham area. If you're on AT&T, you can tune in on Channel 99 and click either Birmingham or West Bloomfield's Community Access television channels. You'll find us today on CivicCenterTV.com on the web in full high definition. We have a Facebook partner every day. Today, our Facebook partner happens to be the West Bloomfield School District. You can go to their Facebook Live channel and watch us there. And then not one, not two, three great radio stations across our area. 89.3 Lakes FM, 88.1 WBFH, the Biff, and WAHS 89.5 Avondale Community Radio. They tell me that the Biff and Avondale Community Radio put a pretty good signal into Birmingham, and that should make this guy happy. I know he listens every second of the day. Joseph Valentine, the city manager of Birmingham, checking in via Zoom. City manager, thank you very much for joining us today, and it's good to talk to you. How you doing? How you feeling?
I'm well. Glad to say it. Hopefully you're doing well as well. And, for all your viewers out there, we're hoping everybody's doing well.
Well, we are doing as good as we can. And for the most part, I think a lot of people have really come through this okay. And our deepest sympathy to those who have lost loved ones and family and those that are suffering. We're thinking about you every day. We're also thinking about the first responders every day. In Birmingham, we love Joseph Valentine spending time for those people, even those that are listening all across Oakland County that don't live in Birmingham. We all love going to downtown Birmingham for a walk or get a cup of coffee or a shop. So it's been tough. How's Birmingham doing right now?
Well, we're doing like everybody else right now. I mean, it's tough. There's no question. Our businesses are struggling. Those that are open, they're doing okay. I mean, they're having some activity from the restaurant carryout perspective, but it's tough. And making sure that everybody's getting the money that they've applied for, whether it be through loan or grant programs. I mean, it's a struggle, and we're doing everything we can to try to keep these folks around and help them through this.
Well, we want to do all we can to make sure the small businesses in particular can survive this because, you think of a community like Birmingham and just the retail side, which is a pretty important part of Birmingham. Most of those retail establishments in your downtown, they're small businesses. They're unique, novelty, small businesses, and they got to be really having a hard time.
Yeah, there's some struggles. I was on a call this morning with some of our business community, and And there are challenges that they're trying to overcome. And there's no question it's going to be difficult. And there's no more time that's more important than right now for shopping local. I mean, the opportunity and the convenience to buy things online is there. But in the next few weeks, as these retailers are able to start opening up again, it's going to be real important for everybody to support them and come out and do what you can to shop local during these difficult times to help everybody through it.
Well, I think people are ready to do that. We're just dying to get out of the house and shop. Are many or any of the retailers in downtown Birmingham or across your entire city taking advantage of the curbside retail that is available right now?
We have had a few, yes. So as you said, people were eager, and we've had a few businesses that have opened up for the pickup service, and hopefully we'll see more in the coming weeks as things progress. But I think a lot of it is getting people back from the layoffs that were done a week or so ago, and trying to get the staffing levels where they need to be, and getting the inventory back, and trying to keep things moving. So it's going to be a little while, but I think in a couple weeks that you'll see, as long as everything continues down the path we're on now, we'll see a stronger business presence here in downtown Birmingham.
Joseph Valentine is a city manager in Birmingham. Certainly the governor's making most of these decisions, or certainly in a leadership position on these decisions right now. She's taken a lot of input from business and community leaders around the state of Michigan. City Manager Valentine, if the governor is sitting in your office, what advice would you give her today about what would be in Birmingham's best interest right now?
Well, I think, again, from our perspective, it's really our big business community that's struggling the most right now. I think people are eager to get out, participate in some of the recreational activities that we have to offer in our community. And that's always a cautionary tale until we get a little bit more clarity on what is appropriate for people to be participating in. We've opened up our golf courses, as that was permitted just a week or so ago. And we're getting more activity from, I think, the families that want to come out and get into the parks and kind of resume their normal lives. But until we get the clear go-ahead to reopen the playgrounds and tennis courts and ball fields, it's a little bit of a struggle for our residents that really want to get out now, especially since the weather's getting better.
Well, it is, but I do see a lot of people. I drive through Birmingham every day, and I see a lot of people that are getting out and enjoying the parks, taking a walk, and really enjoying the beautiful weather that we have. And I'm just seeing people act so responsibly, doing things safely. We've not seen, people congregating like they have been doing in the beaches in Florida and California. For the most part around here, I see things going pretty well. Has law enforcement had their hands full trying to get people to comply, or are things going okay?
No, on occasion we've had some calls where we've had to go and assist with some disputes over distancing, more so maybe on construction sites early on and things like that. But mostly from the neighborly perspective, you're right. People are doing the right things. They're, keeping their distance and, able to have conversations with their neighbors responsibly. We have walking trails through the community that we promote, and we've had a lot of activity on those. But we really haven't had many complaints per se with regard to people just getting out. It's really more in the areas of construction activity or wanting to get into some of the parks and recreational opportunities that people get a little closer, having impromptu basketball games that we've had to break up and advise people that it's too early yet.
Yeah, a lot of people, they just, they're not thinking, they get excited, and they think, I'm going to go do this, and then they forget. So a little reminder is helpful. Joseph Valentine, City Manager of Birmingham, joining us on the Megacast, and it's great to have you with us today. We really appreciate it. You talked about construction. Construction's coming back in just a couple of days, residential construction. And I just think of the boom that your community and a lot of the other communities around Metro Detroit that don't have a lot of new development space. We've just seen amazing redevelopment of residential properties in Birmingham, Royal Oak, Berkeley, Huntington Woods, the whole area. Birmingham, no exception. It's been great, and I'm sure homeowners and contractors will be really happy to get back to work in the next couple of days.
Yeah, we've got, I think, probably close to 130 open construction sites right now that we've had to halt. So with this order coming up on May 7th that construction can reconvene, they'll certainly bring a lot more activity to the community and obviously keep these projects moving. But now that it's been permitted as appropriate and legal, there's a lot of people just waiting in the wings to get started again.
Yeah, and I know there were some issues and some people were impatient and wanted to get going, but that's all behind us now, and the rules have been changed, and we are ready to go forward. Speaking of construction projects, right in downtown Birmingham, you've got a beautiful brand new hotel under construction. Hopefully, the hotel industry will survive. I'm sure it will, and that new property will have a bright and long future. How's construction coming on that project on Old Woodward?
Actually, on that project specifically, it's a 126-room hotel that's under construction. Pretty much the core and shell is all done. They're now working on the interiors, and their goal was to have it open by the end of July. I think they've got to move that back a little bit now, but later this year, I expect we'll see that hotel opening. And
finally, City Manager Joe Valentine, Maple Road, a lot of work going on. Maybe it wasn't the worst time of the world to schedule some changes to Maple Road, but what's going on there and what's the timetable on all that?
Well, we have, Maple Road's going to be under construction from Southfield to Woodward, and with any project like that, there's never a good time to do it. Unfortunately, we have to address that section of road because that is probably some of the oldest water and sewer lines in the city right now. And we started this process a couple of years ago when we started with Old Woodward to really start addressing that old infrastructure in the city. So we started with Old Woodward 2 years ago. We gave the downtown a break. This year we planned for Maple Road. Unfortunately, we've got hit with this COVID issue, so we're trying to manage that as well. And the timing isn't necessarily the greatest for our businesses, but we've got to jump on that project. The contractors are now working. That's going to be a complete a redo of not only the infrastructure underground, but everything above ground from building front to building front all the way across Maple Avenue or Maple Road. And we're going to have new sidewalks, new streets, new planters, new charging stations, new trees, new landscaping. It's really everything. We're fixing some ADA issues that existed previously with that section of road, having a double curb condition. So we're really doing a lot to really improve it over there. We're fortunate too that we've also received a grant from the federal government for about $700,000 to put toward that project to offset some of those costs.
Well, good luck with it. It's never, anyone who's had their kitchen remodeled knows, it's inconvenient when you're living in the home and you got to get some work done, but we'll get through it. And you're right. I guess it is kind of a double whammy for businesses. They've had to suffer with the coronavirus in this, but our thoughts are with them. We'll do everything we can to encourage people to shop at those stores as they open back up, even if there is a little bit of sawdust around and cement.
So a lot of programs too to help support those businesses. So if you go to our website, you'll see some of those programs with some quarantine cash and other initiatives to help them during this time.
Excellent. That's what we like to hear. We talked to the folks in Rochester, and I know West Bloomfield held a meeting on Friday talking about working on plans to begin to reopen up government so people can come into City Hall. How are things going on that front in Birmingham?
Yeah, similarly, we're working on our plans here. The idea is we have to wait and see what the requirements are from the state. But planning ahead, we're anticipating that, we'll be opening up. We have the opportunity now for a drop-off location where people can drop off either permits or plans or applications, and we can then still process them, maybe not as timely as we did before, but still get those processed for the community. Going forward, as we look to open the buildings, we'll be having the screens in front of the stations where the employees will be working to ensure their safety as much as the public safety is going forward in this new environment. So, having hand sanitizer stations, not only in the buildings, but outside in our parks, in the downtown, trying to instill as much safety as we can during these uncertain times.
Well, good job. It's not easy, and then it's every day. You got to do it every day. I mean, we've been working every day to keep our facility safe, and it's been a positive result here. None of us have gotten sick, and I know you're working hard to make sure your community doesn't have to suffer any more than it need to through this coronavirus crisis. Joseph Valentine, thank you very much for joining us today in the Megacast. Good to meet you, albeit virtually, and hopefully we'll get a chance to meet in person sometime soon. I always give everyone an opportunity before we say so long. Is there anything I missed, anything else that you want to share with folks in your community and around Oakland County?
Well, from our community, just from a resource standpoint, I just want to share a couple of things that we're doing to help people during these difficult times. First of all, we've created a dedicated web page on our website with virus information, not only virus information, but community resources, where if you're needing something or looking for assistance, there's a bunch of resources there that can assist you. We've also created a COVID hotline that's staffed Monday through Friday, 8 to 5. And that number is 248-530-1805. For anyone in the community that has any needs for assistance or requests for information, our hotline is there to assist you. And then lastly, we set up an citywide email notification system where we can reach out to pretty much everybody that signs up on a regular basis with the latest information from the city.
All right. Well, I look forward to the day when we can get together in downtown Birmingham and listen to one of those wonderful evening concerts and everything is back to normal. And the day will come. I look forward to it.
I'll give you an open invitation.
Thank you, sir. Joseph Valentine, city manager of Birmingham, joining us. And good to have you with us. Thanks for taking a couple of minutes.
Thank you, David. Appreciate it.
Very good to talk to you. We're going to take a break. We'll be back in just a moment. Next hour here on the broadcast, Nicole Foley, who is with the Jaffe Law Firm. We're going to talk about employment and labor issues. You know, I was talking to some folks, Tyler, the other day. It gets a lot more complicated than you'd think as your employees come back to work. You know, what's going on from an HR standpoint? What if an employee doesn't want to come back? What if some employees at some, additional health risk? Issue after issue after issue. So we're going to talk to Nicole Foley in a little bit. And then we're also going to be joined by one of our lawmakers from Lansing. Senator Rosemary Bayer is going to join us of the 12th District. She is standing by. We'll get to her in just a couple of minutes. This is the Megacast.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Stay home, stay safe, save lives. Good advice every day. And thank you, Doctor, for sharing that with us. Hey, Dave Scott, Tyler Keefe here. Thank you for watching us across our Oakland County coverage area. A big shout out to our radio stations, WAHS Auburn Hills. It's 89.5 Avondale Community Radio. 88.1 WBFH Bloomfield Hills, better known as the Biff, and 89.3 WBLD Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake. That is better known as Lakes FM. Thank you for our radio stations for being a big part of our broadcast. We are live today on Birmingham Area Municipal Access TV Channel 15, and we are also live on Civic Center TV Channel 15 in the West Bloomfield and Lakes area. So thank you for tuning in there. You can tune in on CivicCenterTV.com, where you can watch our full broadcast in high definition. And every day we have a Facebook partner where we broadcast live over Facebook Live. Today, it happens to be the West Bloomfield School District. And Tyler, every time we're on the West Bloomfield School District Facebook page, thousands of people watch, and we appreciate that.
Absolutely. We get a lot of people that watch, students and families alike, that are interested in finding out what's happening in their community, particularly in their schools. Yeah,
the audience that tuned in the other day, though, on Oakland University's website when they were our partner, wow, 27,000 people tuned into our silly little broadcast. That just warmed my heart. So Oakland University, if you're watching again today, and all the people on your Facebook page, thank you very much for tuning in. Joining us now, we see her via Zoom, is Senator Rosemary Bayer, and she is from the 12th District. Bayer, do I have that?
Bayer.
Bayer, yeah,
like
Bayer, of course. Looks like it's spelled just like that. I knew that. I pronounced it right earlier. I don't know. I got all nervous when I got you just smiling at me right here in Zoom. Senator, thank you very much for joining us. You are representing Michigan in the 12th District, and that is a big chunk of our listening area. I appreciate you taking time for us today. How you doing? How you feeling? And where are you?
Well, where I am is in my home office, of course, in Beverly Hills. Part of your area as well, and enjoying this absolutely beautiful day. I'm hoping to get outside.
Yeah, what a great weekend, huh? It was awful nice. Well, we need some sunshine in our state of Michigan. Just so people, if they don't know, you are a Democrat in the Senate here in the state of Michigan, and it's been a challenging time. We had a tough week, and I kept telling everybody, I said, this is going to be a little bit harder to untangle than it was to tangle up, and no question about it. I mean, we all saw the news. We had protests in the Capitol. We had the governor going in one direction, certainly the Republican leadership going in a different direction. Do you just can you just wrap up last week in some way that we can all digest it? And I would love to hear your thoughts on all that,
Sure,
or wherever you want.
Of course.
Wherever
it was an interesting week up there. I'll say that. I can't argue with that a bit. But so first of all, I will say that, I'm new to politics. So I came into this job last year. I'm actually a computer engineer. I'm a computer scientist, a data scientist. This is pretty different for me. And the other thing that I did before I got here was I was an activist and a protester. So I actually am a strong believer in the right for people to protest. So it was nerve-wracking on the protest side, mostly because of the open carry the guns. And it's not so much that the idea is itself bad, it's that when people are in crowds, accidents happen, things happen that they wouldn't normally do on their own, that crowd mentality thing happens, or just plain old accidents when you get a lot of people proud of the other. So that was nerve-wracking, and they were not very well behaved as protester goes. I've been in a lot of protests with a lot more people than that, and people were better behaved than that group. I was kind of very disappointed to see them kind of right in. Our poor sergeants did such a great job there trying to maintain order, but they wore no masks and they didn't do any social distancing. And so their faces right up in the face of the sergeants with no real protection. They're wearing masks, but not really good ones, of course. And the other guys were just sort of shouting right at them. And, that is not at all appropriate. I felt very bad. And some of our senators were really nervous about having people there with the guns, it was intimidating, and they were nooses and other things that clearly were designed to be intimidating rather than here's what we have to say.
So, Senator Bayer, thank you very much for being with us and sharing your background. It's always nice, to get some new people in the Capitol, and good to know your history as one who certainly has been an activist in protesting in the community. So, first of all, before I go where I was going to go, so you were in the Senate chambers. We know the protesters were right in the Senate chambers. Can you talk about your emotions at that time, and were you fearful yourself?
I was not, actually. And I know other people were, and I totally respect that. It can be fearful. I am from a family that grew up with guns in general. Not that I actually don't agree that we should have people with rifles up there in the gallery. It is intimidating for many people. And it impacts your work, just thinking that there's such a thing, that something could go wrong up there. So yeah, I disapprove of the idea of that. But generally speaking, I grew up in the country, people had guns. It's not, that part of it is not the problem. It's the overall intent of the protest was the issue.
And I will get beyond.
Right next to me was Senator Santana, and she was literally wearing a bulletproof vest. She was very, very nervous about that.
So were there others that were, and I will get beyond this line of questioning. So I'm just curious. We weren't there. We see it. See, this is what's cool about the show. We see this stuff on TV, right? You see it on TV, and a lot of the media, they have their own agendas, one way or the other. So it's hard to really get a sense of what was really happening. So, on behalf of all your constituents, thank you for telling us the story. Were there other lawmakers that you think were wearing bulletproof vests then? They were worried about that?
I only saw one. I don't know if some, I think there was only one on our side of the floor. Most of the day, the Republican senators were in caucus, so we didn't actually see them very much. I know a lot of them were outside walking around amongst the crowd, so possibly they were. I don't know though. I didn't see that.
Senator Rosemary Bayer joining us from Michigan's 12th District right here on the Megacast. Thank you very much. So let's talk about where we need to go. Your thoughts. Where do we need to go? Any comments on where we're at right now and where you would like to see us go?
Sure. Well, of course, like everyone else, I would like to see us get back to normal. That's what we're all getting excited about. There's a lot, we are really doing well in the state. And I know it's frustrating because everybody wants to get out there. I know yesterday I saw a lot of cars and I saw a lot more people outside. And it's understandable. We want to get outside, but we still aren't there yet. So we really have to maintain the careful protocols that we've put in place. So and I know that Dr. Calhoun was trying to reinforce that in the last press conference with the governor to make sure people recognize that we are doing really well. And the reason we're doing really well is because we're being very careful. So it's too soon to give up those careful practices. Now, that being said, I think there's a lot of positive things going on. I was at a meeting with the Citizens Research Council. I don't know if you're familiar with them.
Mm-hmm.
They do a lot of work with data. And so, of course, I'm a data scientist. I'm always drawn to the people that actually take the real data and analyze it. So they're looking at recovery and what does our recovery look like? And from my work in the Senate, most of my committees are budget committees. I'm on the appropriations, but I'm also on subcommittees like education, which is where my heart is, and transportation, some of these big things that we have to do. So looking at what the experts see in our recovery, and this is a group that's analyzing data. It's not an answer, it's not legislation, it's none of those things. It's part of the input that we have in looking at what's going to happen and where can we go. And they had a fairly positive aspect, and the reason why they think we are in better shape than we often feel right now is because our economy slowed down, right? We're in a slowdown where our revenues are down. I mean, most people are not working. So, but that is driven by legislation as opposed to the economy. So, because Michigan is, primarily our big employers are manufacturing and healthcare. And both of those things, as soon as we are ready, as soon as we have this thing under control, both of those things are turned back on. So it's not like we have to rebuild everything again for those things to turn back on. So that was a really interesting perspective. And in their data, they showed a sharp line on the recovery side going up. It doesn't go all the way back right away. It goes up fast and then it keeps going up. And I think because small businesses are going to be struggling to get back, and the companies that did not get help through the different processes and things that were available between the county and the state and the federal government, if you didn't get help from those places, then there's rebuilding that's going to have to happen, and those will take longer. But the majority of the people employed in this state are ready to get back to work, and that's really an important thing to remember. I don't think it's going to take us as long to get back as we're afraid of. It's not like 2008. It's not like that at all.
Senator Bayer, I think I've found an optimist. I think I have. I like that. I feel the same way. I think we're going to come back. Looking at it realistically, though, there are a lot of businesses that have been impacted. And not everybody got the PPP money. Not everybody got the Oakland County money. Not everyone, but a lot of money was thrown back into the economy. And I saw a report on the national news yesterday that said we've almost put as much money back in the economy as has come out over the last month. But now it's really important that we are able to get things back open again. And we just talked to Joseph Valentine, city manager of Birmingham. He seems eager to get his downtown rocking and rolling one more time. So if you are talking to the governor, I don't know if you talk to her every day, but if you were, and she was asking your direct counsel, what would you tell her about how to open things back up?
She's doing it exactly right, actually. So, and it's again back to my data background. She is very, very carefully doing this with data, right? Every step we take, we then analyze what happened. We watch for 4 days, 5 days, 6 days. We analyze what happened. That administration of hers, she has some amazing people in there. Dr. Calhoun's team, I mean, looking at the data and deciding, okay, now we can take the next step. Okay, then we're going to take the next step. And then we can stop if we go too far. Rather than having to shut everything off and start over again, we just slow down again, we catch back up. I mean, we're managing it. I think that is the best way for us to get through this. I really think she's doing the right thing. The things that I'm working on right now, the other piece that is really critical that we just have to spend more time on, I think, is the education side. So I just got off, and so it was nice that you mentioned your partner is West Bloomfield Schools. I was on the meeting of all the superintendents in Oakland County just before this. And of course, your Dr. Hill from West Bloomfield was on there and talking about the things that they need to be ready to get back to school in the fall. Because school is not only education, right? That's the critical piece. If we don't get people back into school, that's our recovery is going to be stopped. And partly because people won't be able to get to work. I mean, school is the #1 provider of taking care of kids during the day also. So all of those things, there's a number of things that have to happen for schools to be able to go back in the fall and to be safe and to be clean and to be, be able to do social distancing as prescribed by then, and transportation, and do we have enough teachers, and all of those things that are going to have to happen by August, which is right around the corner.
Senator Bayer, you were on the call. Thank you for sharing that story. I really appreciate that. And we, on this show, we talk to a different superintendent almost every day across our area. We've stayed in very close touch with them. And I think the work the schools have done has been just amazing, to get the education into the hands of the students in their home, their parents helping out their kids. School districts have gone much further than just educating our kids in our area. They've been feeding them and, just getting in touch with the community on so many different levels. Dr. Hill is a great example, but, it's all of our superintendents doing an amazing job. But if you were to take the temperature of those superintendents that were on the call you were on just a couple of moments ago, what would you say their feeling is about actually having their physical buildings open in the fall? I mean, what do you think about that? Is that going to happen, or don't we know yet?
Well, I think it's going to happen. I think they think it will happen. The question is, in what manner? So because there's likely to be some kind of distancing control still at that point, how do we do that? In elementary schools, it's probably a little bit easier to have small groups, right? Small classrooms with kids that are spread out. But in high schools, that's almost an impossible task. How are we ever going to get 1,000 kids spread out enough, right? So this is the challenge, to do blended education in a new way, and there's so many things that are not in place to support that yet. I think just having the tools, having the knowledge of all the different things we're going to need to be able to do it, and it's a very short time frame. So I think that there's a lot that we have to do in the next few months. They are working on it. I don't know that. I already know that. I'm trying to figure out what the costs are, even just the extra cleaning costs, and so many things to factor in. So I don't know what's going to turn out of it by fall. I do think that we will have buildings, unless we end up with another resurgence and we have to go way back. The path that we're on, we should be able to have school buildings open.
Well, I know they're working on it, Senator Bayer. I know they are.
Yeah.
Pat Watson at Bloomfield Hills School District, superintendent there. He gave us our favorite quote that we've had so far during this entire broadcast. He said on the show not too long ago, he said, "Dave, hope is not a plan." So that is a really, what a great, I use it every day. It's just perfect. He's right. We can hope that we're open in the fall, but we don't know.
And they're working, I will tell you that. So Superintendent Vlasic was on the phone. All of the superintendents in this area are in this meeting. Everybody is working, and we're getting ready on the legislative side. What are the things that need to change to adapt to what you need, right? We can't be counting the old way, the butts and seat way. That's going to be different now, right? Sometimes people are going to be at home or in some other building or some other location. And one of the things that I've been working on is working with the department and the ISDs, right? The Oakland ISD and the rest of the ISDs in the state, to make sure that all kids have access to a network every day, so that as we do blended education models, everybody can participate, right? So lots of pieces.
So, the legislature and everyone in Lansing is going to have their hands full figuring out how to make the money work. We got a huge hole in our budget. We know that. Dr. Schwartz of the Avondale District was on our show not too long ago, and, he just was, taking a guess. He said maybe they may be losing $500 a student in state aid. Do you think that number is close? And do you have any idea, where do you think we're going to end up? Are the schools going to have the money they need in the fall and next year to do what we need to do?
I wish there was an easy answer to that question. I mean, we definitely are going to see we are seeing a decline in revenues, and it's significant, right? It's not small across the board. I know that as we start talking about budget for next year, obviously we're trying to protect the schools at the top of the list, right? It's highest priority. The other thing that we're doing is working with our congressional reps and our U.S. senators to advocate and figure out how we can get education funding into the next stimulus act, right? So both the foundational funding, which is just running that operation there, also the IDEA Act, which is the special ed funding. The commitment from when that started in 1975 was that the federal government would pay 40% and they pay 15%. So even if we just could get that money, that would make a big difference. It would free up their operating funds from having to make that up. And so we are working hard with on the federal side to get that done from there and get some help from outside, because there's only so much we're going to be able to do here in Michigan.
Senator Bayer,
it's worth the effort.
Senator Bayer, no one ever said this is going to be easy. Welcome to your new job, but we need really good, smart people in Lansing right now, because this is the biggest challenge we've faced in years. Yeah. We got to take care of the education. We got to make sure people are healthy. We got to get our economy going. We don't want to create a bigger hole in the budget. It should be nice if we can fix the damn roads along the way too. So, we have all these things. It's, that whole thing is going to get a lot harder, right? I mean, if we don't have the money that we anticipated, you guys are going to have a hole in your budget. Listen, I always thought it'd be fun to be a lawmaker, but you can have it right now. You guys, you got your hands full.
Me, most of my committees are budget committees.
So I wish you the best of luck. Hey, thanks for coming on our show. It's really good to meet you. I look forward to meeting in person. And is there anything else you want to share with the folks before we say so long?
No, I just want to thank everybody for doing their part, right? The people that are out working, the healthcare workers, first responders, grocery stores, postal workers, everybody that's out there. And thank everybody who's staying in as they should and taking care not to help the spread and help us get this under control. It's working. We're doing it right. Yay, yay. Thanks, everybody.
All right. Thank you very much for joining us. I appreciate it. Good talking to you. And she is Senator Rosemary Bayer of the 12th District here in Oakland County. We're going to take a break. We'll be back in a moment. We're going to talk to a lawyer and find out some of the tips that you need if you're an employer and you're getting your people back to work. What do you have to be aware of? What do you need to be careful of? And if you're an employee, let's talk about your rights, too. We're going to get it from both sides. Nicole Foley joins us. She is a partner at the Jaffe Law Firm, and she'll be with us next. Tyler and I will take a look at headlines as well, and we will also run down our updated list of our COVID-19 vocabulary when we return. This is the Megacast. I'm Dave Scott. We'll be right back.
Hi. My name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Thank you very much, Kurt Lawson. One of our fine folks from law enforcement and one of our great first responders in our area. With those reminders, Tyler Keefe, Dave Scott in our Lakes FM studios. And Tyler, it's easy to forget to remind people of the fundamentals that we all need to, put into our daily lives. Washing our hands, doing all the things that Kurt was just talking about. You got to do it, and it does. It gets harder after you've been doing it a month. The first couple of days, okay, but it gets harder day in and day out, and now it's even more important as we are opening up our stores, our businesses. When we are at home, maybe you get away with keeping the virus in your home, but you're traveling around the community. Now you really got to do these things.
Yeah, absolutely. And it's tough to add anything new to your daily routines and the things that you're doing all the time, but it's important that we do add those things. Add hand washing, added cleaning of your home and surfaces, wearing your mask and knowing how to properly wear a mask or properly create a cloth mask if you need, and when and where you should be wearing that so that we can continue to get out of this hopefully as soon as possible.
Well, thank you for joining us all across Oakland County, or at least across much of it here on the Megacast. I'm Dave Scott. He's Tyler Keefe. And we thank you for joining us on Birmingham Area Municipal Access, Channel 15, Civic Center TV, Channel 15. If you're outside of those areas, West Bloomfield, Birmingham, the Lakes area, Sylvan Lake, that area, if you're outside of those areas and you are a subscriber of AT&T, you can tune in to Channel 99. We are there. Go to one of the municipal cable links in there, and you'll find us. Also, easier to find us on CivicCenterTV.com. Just go there. Tomorrow, Tyler, I'll spill the beans because we were supposed to have it ready today, and it was so nice this week, and they didn't finish all the work. But our team has been working on a new app, and we are going to launch it tomorrow, and you're going to be able to go to the app, hit a button, and watch this broadcast and get all the Megacast information. We'll tell you about that tomorrow. So big news here in the show. Our programmers have been working day and night to make that happen. Thanks to our radio stations, Lakes FM in West Bloomfield, the Biff in Bloomfield Hills, WAHS 89.5 Avondale Community Radio in the Pontiac and Auburn Hills area, and also covering a bunch of Macomb County. We thank all of you, and thank you again to the West Bloomfield schools who were kind enough to put us on their Facebook page. All right, all of that is a mouthful, but we got through it. Joining us now, patiently waiting through all that, is Nicole Foley. She is a partner at the Jaffe Law Firm, and she joins us via Zoom. Counselor, thank you for joining us here on the Megacast.
Thank you. It's nice to be here.
So you look like you're you don't look like you're in a law office with a bunch of law books and paperwork and stuff. You look like you're in a comfy spot.
Yeah, I tried to pick a comfy spot to do the interview, yes.
Well,
not in the office.
Is everyone doing okay in your home? We ask everyone, we're talking to everyone via Zoom, and we just want to make sure you're doing okay, your family's doing okay, and everyone is all right.
We're all doing well. Yep, I have 3 young boys and super busy with school, but everyone is healthy and doing well. Thank you.
So how's that going? Are they in high school or junior high or elementary school? Or?
No, they're all in elementary school, 5th grade, 3rd grade, and 1st grade, and they have a busy virtual class schedule.
I know this is not what we asked you on the show.
From home.
I know this is not why we have you here, but this is just we go wherever we go on this show. We got time. What's it like, Mom? How's that all going? Are you helping out?
I am helping. It's been really busy with work, so luckily they are pretty self-sufficient. I get, most of my questions from the 6-year-old. So, but they're pretty good they get online and they know where they need to go and where they need to start, and try to take breaks during the day. But it's been a challenge, but everyone's adapting well.
Well, that's good to hear. I'm sure you're balancing it all well. Nicole Foley is joining us via Zoom. She's with the Jaffe Law Firm. It's funny that you're on the show today because I was having a chat with my neighbor yesterday in the sunshine, 6 feet away with our face masks on. And we were just talking, and let me just put this situation out. It's one of a million I'm sure people have. He was on unemployment. His employer got the PPP program, so he took him off unemployment, put him back on payroll, and he is supposed to go to work today. My neighbor is a little bit older, though, and has asthma, and really he doesn't want to go back to work. He feels that it might put his health in jeopardy. So we have an employer side, we have an employee side. I hope you don't mind me just throwing that scenario out in front of you. What are your thoughts on that situation?
Sure. Yeah. I mean, it's not uncommon. I think a lot of people are afraid in that particular situation, probably absent some sort of a note from his physician recommending that he's in a high risk category and that he should continue to stay home. He probably should return to work. So if he does have, a serious health issue like asthma, he should probably talk to his doctor and get a note. And then, he can talk through that with his physician or talk through it with his employer. And, there's lots of different possibilities. If he works somewhere where he can be away from other people, they can try to come up with some sort of a flexible arrangement. If that's not possible, then they really should follow doctor's orders and he should remain off work.
See, you make me feel so good because I was playing dime store lawyer with him yesterday, and that's what I said. Go get a note from your doctor. He said, well, I haven't gotten a note from my doctor since I was in 3rd grade. I said, well, maybe now it's time to get a note from your doctor. So if we do have a note from our physician that says going back to work might endanger us right now, that would be the thing to do. Take that to your employer. Then you don't get into some big debate. Would that be your recommendation?
I think so. Yeah. I mean, obviously, so long as they're legitimate health concerns, I think that employers often worry that maybe employees are taking advantage, and maybe employers are thinking, well, I'm really scared and I should just get a note. But people with legitimate, significant health issues absolutely should be talking to their physicians and getting a note if the doctor thinks that the best thing for them to do is to stay home, and to continue to isolate.
So we've done the basic things as we're getting ready to open up one of our operations. The broadcast operation is essential, but we've only had a couple of us in here to keep all the other people at home. We've done that. We even tried wearing our masks on the air one day. It didn't work out too well.
Yeah.
But at our other facility, which is a non-essential facility, we're hoping it's going to open soon. We got the temperature sensor for our foreheads. We got masks for everybody. Those are the obvious things. What else should an employer do right now as they're getting ready to open their business up?
Well, so employers really need to make sure they have a plan in place, and they should obviously only be returning employees to work who are part of the critical infrastructure, or if they're part of conducting minimum basic operations. And now if they're part of this, new lessening of the restrictions and these resumed employees. So, you should make sure that they fall within one of those categories, and only those employees who are necessary and fit within one of those categories are returned to work. And employers should have a really strong plan in place in terms of screening protocols, social distancing, the use of PPE, and sanitizing and disinfecting. And I think if they have a strong plan in place that addresses each of those things, it does make for a smooth transition. So, the screening protocols can be a little bit challenging because sometimes they're industry specific. Some of the governor's executive orders dictate what you need to do. Some of the local ordinances dictate what you need to do. And so you need to, employers need to make sure that they're following whatever guidelines are set for them. But, they need to be asking questions like, do you have a fever? Atypical cough, atypical sore throat, atypical chest congestion, and some of the local ordinance even ask if there's atypical diarrhea, as all of those are symptoms or possible symptoms of COVID. If you choose to do the temperature check, you can only do it with a touchless thermometer, so you have to think about that. Employers have to think about how are they going to have their employees answer these questionnaires. Are they going to have it all printed out? Are employees going to wait in their car, fill out the questionnaire? Because these are screening questions that employees should be answering before every shift. Are you going to have them line up at the door? And if you do, you have to make sure that they're 6 feet apart. So employers really need to look at how can they best meet these screening protocols and what fits with their particular work environment. The construction industry is just getting ready to open up, and one of the protocols in place is that they have specific entry points so that, because there's a lot more people on a construction site, so people aren't just walking around and you don't know if they've been screened. So employers really need to look at, what screening protocols apply to them and what works for their business and what's going to keep their employees safe. Social distancing, obviously, the 6 feet. It sounds easy enough, but employers really need to look at their business and say, okay, if I'm in an office setting, how am I going to keep my office workers 6 feet apart? Am I going to have them every other desk? What are we going to do about lunchtime? Are we going to have 10 people to the lunchroom at a time because we have 10 tables and they can each sit at a table? And can I set up another area for lunchroom? Can I stagger lunches? And if you're outdoors, if you're in the construction industry, how are you going to keep people 6 feet apart? If you have to get on, elevators or pass in hallways, these are all things that employers should be thinking about and at least trying to come up with safe protocols that they can communicate to their employees. Use of PPE is another one. All employers are required to provide their employees with masks. If you're outdoors, it doesn't necessarily mean you have to wear a mask if you can be 6 feet apart. If you're within an enclosed space, employees are supposed to wear these masks. And then again, industry specific, are you required to provide your employees with gloves, face shields? If you're in a retail industry, should you have a plexiglass in between, you and a customer in a checkout line? These are all things that employers need to think about and check the executive orders, check the local ordinances, check with industry groups. I've even had clients who have checked with their competitors to see what competitors are doing to make sure that they're trying to do, all of the things that they can do to keep their employees safe.
Nicole, thanks for making it so easy.
Yeah. At least I'm
kidding
giving
me?
people things that they need to think about. That's the most important thing. What do I need to be thinking about? What do I need to be considering to keep people safe?
I'm so glad this is, listen, I said this, I'll keep saying it. This thing got really tangled up, and this was a tangled mess, shutting it down. Untangling it, oh my goodness, this is complicated.
Yeah.
Least we even get into the political challenges going on in Lansing right now, which we're going to leave on the sidelines for today. Just trying to figure out how to implement this is not easy. You were going to add one more thing before I interrupted you.
Oh, no, just, the sanitizing and disinfecting.
All right.
Just making sure you have those things available. Really, to have a smooth transition is having a plan, communicating that plan, being confident about your plan, and listening to your employees when they raise concerns.
Nicole Foley is joining us. She's a partner with the Jaffe Law Firm. Nicole, how do we get, what do we do to help people get this information? Because I look around on the internet, Tyler, you could tell me if I'm wrong, but I don't see that list organized easily anywhere. You got to read through the governor's order and figure out this and figure out that. Do you see that anywhere, Tyler?
Not in great detail.
No.
I mean, other than like you said, reading the governor's order, it's tough to kind of decipher what exactly those regulations are and how it applies to your workplace.
Nicole, I think I saw you have a legal pad there. Can you just send me a copy of whatever it says on that legal pad, or hold it up to the TV?
There you
Yeah,
go.
see?
Here's my notes.
Yeah, there you
My
go.
scribbled, messy
Hold
notes,
that back
so I
up for
wouldn't
one more
forget.
second. That's going to be like, remember when, was it Tim Russert who was during the election, remember doing the thing in front of the nation? That's kind of what your legal pad is like. So we don't have your legal pad and we don't have your experience. What do we do, Nicole Foley, partner Jaffe Law Firm?
Well, feel free to check out our website because Jaffe does have a lot of different sources of information. I created a quick glance, if your employees are saying they have certain symptoms and what do you do in response to that. So we have lots of good information on there. So I do actually have checklists. So absolutely check out the website. And, the CDC has good information. OSHA has good information. And I am actually going to be working on putting together a little bit more comprehensive return your employee to work plan. So you can certainly check out the Jaffe website and see when that checklist comes out.
Well, maybe we can have a conversation offline. We could put some kind of video or do it. We could do a whole show. I mean, literally on this issue because it's complicated. You say go to the CDC site, Counselor. I don't mean to, contradict your instructions, but you'll get one story from the federal government. You'll get another story from the state government. And here in Oakland County, Dave Coulter and the team out there doing a really good job, and they have their own set of regulations. You got to take all of those. It's not really that easy. So, man, I'm so glad that we met and that you're here to help us figure this out because it's complicated.
It is complicated. It absolutely is. And I think everyone really is doing their best.
I think so.
And that's all you can ask for.
I think so. And then, from an employee standpoint, should there be like another checklist for employees? Because not every employer is going to get this right. Some are, some aren't. And, I don't think there's anything wrong with an employer or an employee, rather, in a nice, non-confrontational way, telling their employer, look, I think you missed this step. You might want to take a look at it. You don't have to make a federal case out of it. But,
Right.
Don't you think that's appropriate, too?
I do, absolutely. And I think that employers should really listen to employees who are making these types of suggestions because there might be things that employers haven't thought about. I had a client who was putting together a plan and the employee said, well, what about the lunchroom? What if we're all touching the refrigerator? And so they sort of sat down and came up with a plan that for the next couple of weeks, you can only bring your lunch from home in a thermos. Or, you go eat in your car, or, they came up with plans because the employer frankly hadn't thought about how people were going to be using the lunchroom and using that space. So these are things that employees are thinking about and they are concerned about, and employers should take those concerns seriously and try to be flexible and come up with different plans.
Nicole Foley, partner, Jaffe Law Firm, joining us today, talking about reopening our businesses and how it's all going to work. Would you say that your average HR director in a company that's got maybe 50 or more employees, that HR director should have all this information through the resources they have, or do you think they're also struggling to figure these things out?
I think it's a little of both. I think that HR directors are very cognizant of how difficult these issues are. Hopefully they're reaching out to their counsel. And I think that people are slowly trying to put this information together. And I do think that HR directors are trying to come up with a plan that's going to keep everybody safe.
All right, Nicole, I appreciate you joining us. And I really empathize for people that have businesses like mine that, we got around 20 employees and businesses that are smaller. You just don't have all these other resources. It gets confusing. You're trying to, run your business, keep things afloat, apply for your PPP loans, keep your employees' heads screwed on straight while they're going through the same things you're going through. And then now I need your whole legal pad on top of it. I mean, it's hard, especially for the people. And there's a ton of us out there, all the restaurants and the retail shops. And these guys, they're not open yet, but they're all getting ready to open. And they're, over the next month, a ton of people. I don't think we're getting in the weeds here. A ton of people, virtually anyone who is either working somewhere or employing people, they're going to have to go through. They're going to have to know all of these issues, don't you think?
Yeah, absolutely. Absolutely.
All right. Well, listen, I'm delighted to work with you and anyone else that wants to help get the information out. So, you're obviously in the business of being a lawyer making money, but you're helping people, I presume, by getting this information on your website so people that aren't even your clients can go there and at least get some information and get some help.
Absolutely. There's lots of information on there that anybody can go on and take a look, print it off. There's some really good checklists on there across all different, areas of the law, contracts and the PPP loans and what to do with them and, electronic banking. And if you have contracts, then how do you meet your contracts? So there's a lot of good information that we have posted on our website. I know other law firms do too, but there's a lot of good information on Jaffe's website.
And then I assume you guys are all pretty busy. If a business owner wants to retain counsel right now to figure this stuff out, to make sure they're not missing a beat, do you think they'll be able to find somebody if they don't have an existing relationship?
I think so, yeah. I think that, law firms are they're refocusing their efforts on getting people back, construction industry. So we're all busy, but we're all working toward the same goal. So I think that lawyers are available to help for sure.
And what are the consequences? Final question. I know you're busy. What are the consequences of not getting this right? I mean, if we do our best and we get close, is that good enough? Or what are your thoughts on that?
I think it's going to depend. I think it's going to depend on how close they get. I think if, depending on where an employer, hopefully, fingers crossed, they don't make mistakes, but, if they make a mistake under the Families First Act, there are consequences like there would be under the FMLA. So those are certainly more severe consequences. If they get something wrong under one of the executive orders or their local ordinances, the consequences are not as severe, except of course, if someone gets sick. So what consequences are we talking about? Litigation in business or keeping people healthy? So there's consequences either way. It just depends on if they get it wrong and where they get it wrong.
Yeah, I was really concerned because I heard a news report on one of the other media outlets today as I was driving in, and they were talking about the challenge that we have right now. Our frontline first responders and doctors and other folks that are treating people, given the fact, and again, I don't want to get too deep in the weeds, but this whole two sets of government authority for the governor to act. One of them is still in effect. The other one expired. And the one that expired had all the protections built into it for first responders and folks so they wouldn't get sued. Because it's not inconceivable. Somebody gets sick. It's not inconceivable. They might try to sue somebody because they would blame somebody for getting the coronavirus. To me, that seems like a crazy case. I don't know how you blame any one person for getting you sick, but that kind of stuff, we got to be worried about that, right? And they'll fix that in Lansing, I hope. But for everybody else, should we, as employers in non-first responder situations, be concerned about the same thing?
Unfortunately, I think that employers always have to be concerned about litigation and employees bringing litigation. In the case of, businesses that are not first responders, it would be difficult for an employee to make a case to be able to demonstrate that they got sick because of their job. But that's not to say that people won't try to make that argument.
Right. And it's not to say that most employers, virtually everybody out there, and everyone listening, at least everyone listening to this extremely high-quality broadcast, all of our listeners, they don't want anybody to get sick. They want. Listen, the employers want to do the right thing. It's just hard.
Yeah.
It's hard.
Absolutely.
Well, thank you for coming on the show. Anything else you want to add before we say so long?
No, just, everyone try to work together and be flexible as we all get through this together.
And again, Nicole Foley, partner, Jaffe Law Firm, your website where there's a lot of information.
We're at www.jaffelaw.com.
And that is JAFFELAW.com, correct?
That's correct, yeah.
Wow, I finally spelled something right, Tyler. All right. Yes.
Congratulations.
Okay. Thank you very much. And I'd like to connect with you when I get off the air today and see if there's anything else we can do to get the message out. I think you did a great job sharing the information with our audience today.
Absolutely. It was a pleasure being here. Thank you.
Thank you, Nicole. Well, Tyler, I thought that was going to be easy.
Yeah.
I thought that was going to be easy. It's a complicated deal getting your company, your business open back. It's not so easy if you're an employee trying to figure out all the things you should do. And we want to be careful right now and want to do the right thing. So good luck. We'll have more information to come, and I'm glad we were able to get that website out. Did that seem like a lot to you, too?
Yeah. Oh, it did. And rightfully so, because there are a lot of constraints to go over. There's a lot of regulations from the state level and from the county level for returning to the workplace, for continuing work in the workplace. And there's a lot for employers to think about in terms of how do I keep my employees safe so that, A, my employees are safe, and B, so that they're not coming back at the company for creating a potentially unsafe work environment. And same thing consequently with the employees. They have a lot to think about too as they return to the office and they're around more people consistently at work, of how do they keep themselves and each other safe as well. So there's a lot of work and a lot of planning that has to go into returning people to work. It's not just going to be a flip a switch situation.
No, it is not, and we wish everybody the best of luck in figuring that out, and we're going to do all we can to continue to make the resources available to you. We'll get that link up on our webpage and invite you to go there. If you are on CivicCenterTV.com or watching one of our many outlets around the area, here are the headlines that are on our webpage today. I'm going to quickly go through these. Oakland County funds manufacturers to switch production to medical equipment and PPE. We're continuing to see more and more companies in our area helping out, doing the things they need to do. Here's a great story on our website. New decontamination device ready to sterilize N95 masks. They can use them over and over. Story says up to 20 times after you sterilize them with the new gear that's been developed. A guy in, where is he? Was he in somewhere in Oakland County? Did it say where? No. David Tracy
Troy.
is set. Where is he? In Troy.
Troy.
Oh, there it is, Troy. Yeah, David Tracy in Troy has set up a movie theater in his backyard and is having a lot of fun. Legal? I'm not so sure. We have to get him hooked up with the Jaffe Law Firm to see if he's doing the right thing. But they're having a lot of fun, and big story on our website about that today. GOP lawmakers say they have another weapon in their fight with the governor, and that is money. Of course, the legislature controls the purse strings in Michigan, just like they do in Washington, D.C. Story all about that today. You might want to go and read that from the fine publication bridgemi.com if you've not checked it out. Great publication, lots of really good information, and it is the most nonpartisan publication I have found online in a long time. So that'll be interesting to see how that whole thing works out. They weren't able to stop the governor's orders, even though a lot of the Republicans who have the majority in the Michigan legislature would have liked to, so now they may use some other strategy. So read all about that if you're interested in the politics of this whole thing. $11 million going to Michigan public housing, and amid the coronavirus pandemic, that $11 million is out of $685 nationally. Good news for Michigan. Cases up north. Should Northern Michigan be reopened? Interesting dialogue going on about that and more on our website today. And then a couple of reminders. Michigan Voter Information Center is available. You might want to think about future absentee voting. And here is a link to that information on our website at civiccentertv.com/coronavirus. And then the link to one of our most useful pages, even with increased testing, and that is the zip code by zip code reporting of cases in our area. You can find a link to that, plus links to all the national and statewide and regional outlets, and links to your local communities as well. You'll find it all right there at CivicCenterTV.com. All right, Tyler. Want to remind people, too, to go to the Carryout Club. It doesn't cover our entire region, but you will find in much of the region, especially the Lakes area, a listing of a ton of great restaurants that have carryout. And if you're looking for a new carryout option for today, you might want to go to the Carryout Club online at CivicCenterTV.com/carryout. And there's listings of a ton of places you can get some really good lunchtime fare. So we would urge you to think about checking that out. Now, we have our coronavirus COVID-19 vocabulary. It's something we started the first day we did this broadcast. We thought, hey, there's a bunch of words here that we don't even know what they mean. And that's been going on since the beginning. We like to go through it, though, on a regular basis, because inside of this vocabulary are the tips that you need to be able to continue to make this a very safe time for you and your family. So, Tyler, I cue them up. You define them, and I want you to notice Tyler has a blank legal pad in front of him right now. You can see on camera. So this is all right off the top. I got the cheat sheet here. Tyler does this without a cheat sheet. Flatten the curve, Tyler. Flatten the curve.
Flattening the curve is a concerted effort by the population to take measures to make sure that we are not seeing an exponential rise in cases of COVID-19.
When we started this, we talked about social distancing, but really it's physical distancing, and we've updated the vocabulary.
Yeah, it's keeping a safe distance from other people, preferably about 6 feet or greater, to reduce the chance that you can either pick the virus up from them or spread it to them.
I don't hear too many people talking about fomite transmission. But
it's not a lot talking about them, but they should be talking about it. It's an easy way to pick up the virus. Fomites are things like surfaces or other people even that you may make physical contact with that could then carry the virus, and then you may touch your face, your mouth, your nose, your eyes, your ears, and that's an easy way to pick up the virus. That's why you're also told not to touch your face.
Right, don't touch your face and wash your hands. And while you're washing your hands, you might want to sing
the happy birthday song. It'll get you about 20 seconds of washing your hands. You sing that once or twice over while vigorously washing all areas of your hands and your initial wrist area, and you'll be good.
I think the biggest surprise that we had at the beginning of this from a medical standpoint that is no mystery anymore is that a lot of people are asymptomatic. What's that?
Yeah, if you're asymptomatic, you may be carrying or currently be infected by the virus without showing physical symptoms.
All right, then we got a bunch of new phrases like new normal.
New normal is the new status quo of our society. It's how we are going to be behaving going forward as a result of the COVID-19 pandemic.
Curbside testing.
That is quick, expedient testing, usually done in a drive-through setting that allows people to quickly drive up, get a quick test, and get quick results within a couple of days.
We heard today that we might have to add curbside graduation to this.
Might have to.
Yeah, abundance of caution.
Abundance of caution is taking extra precautions to make sure that you're protecting yourself and others from the coronavirus.
And the stay-at-home order.
The stay-at-home order was issued by the governor. It is ordering non-essential businesses to temporarily shut down and non-essential employees to do their best to stay at home unless they need to go out for essential services like food or groceries.
Megacast.
Megacast is a combination of efforts in broadcasting between multiple outlets in multiple forms.
To get a larger audience and get the word out. That's what this show is.
Very much.
PPE or PPD?
PPE is personal protective equipment. That's masks, gloves, gowns, face shields, and so on.
Coronavirus pandemic dreams.
Weird dreams as a result of the coronavirus pandemic. You're either stuck at home and you're not getting the usual stimuli of the day, or you're out and about, you're working, and you got the stress of the day on you, and it just makes your brain hyperactive, and you go to sleep and you have very odd dreams.
I had the weirdest dreams this weekend. Mine don't go away. I still got them. I don't know if it's medically induced or it's more environmental. I think that's more environmental. You had some weird ones too?
I had a dream this past weekend that I was in one of our back rooms back there. I was at my desk and someone was in the back room, presumably an employee. I didn't recognize them, and all they were doing was hitting the power button on one of our critical systems, and I was afraid they were shutting it down.
Hey, they kept turning it off. You were trying to keep it working? Yeah,
I had no clue why that came up, but it did.
Contact tracing.
Contact tracing is making personal contact through the phone or through email or some other form of communication with somebody that has been in contact or has been with someone that has been infected with the virus, so you can kind of track where it may be spreading.
Here's a really good one that came from Dr. Taweel, our physician here on the show, a couple of interviews ago, and he said non-dominant hand.
So your non-dominant hand is the hand that you use less often. So for me, I write with my right hand. I throw a ball with my right hand. My left hand is my non-dominant hand. And it's suggested by Dr. Taweel and others that you use your non-dominant hand to open doors, to pick up sheets of paper at the office, to move things around, because you're less likely to then take that hand and scratch your face when you have an itch. So it reduces your chance of picking up the virus through fomite transmission.
That's an awful lot. That's an awful lot to think about. I appreciate the advice, but I don't know if I'm using my non-dominant hand or my dominant, but a good advice. Antibody testing.
Antibody testing is much like the testing for if you have the virus. It's testing if you have certain cells in your body that have helped to fight the virus off or could help to fight the virus off and could determine if you are potentially immune to the coronavirus.
Right, and you might have been asymptomatic and got the virus and you didn't know, and then you go in and you get your test and they say you have the antibodies that meant you had the virus, but now you're protected from it. And then the final one I'm going to add, it's not on our printed list today, but an expression that we quote often on this show, and it is, hope is not a plan.
So hope is not a plan, coined by Bloomfield Hills School District Superintendent Pat Watson, is urging people to make plans for various different situations within the virus, because hoping that things are going to go away is not going to solve the problem.
Exactly. And that works for all kinds of scenarios right now. If we all hope, we pray, we are optimistic, we're hoping things are going to get better, but you know what? In these times, nobody knows. I don't care what expert you talk to. no one really knows exactly where this whole thing is going, and that's why we're here every day to help you through in any way we can. So, hey, that's it for the broadcast today. Thank you very much for joining us. Huge shout out to our radio stations, WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, 89.3 Lakes FM. Thank you so much for all of you for getting the broadcast out to so many people. A big thank you to Birmingham Area Municipal Access Television, BAMA in Birmingham, Bingham Farms, Beverly Hills, and Franklin carrying the show. And our Civic Center TV family, of course, the Greater West Bloomfield Cable Communications Commission, who operates Civic Center TV and Lakes FM and makes all this happen. And their outlets, of course, Civic Center TV Channel 15 and CivicCenterTV.com and Lakes FM 89.3. Thanks to Tyler, doing a good job. Ryan is the only other one in the building. He's doing an amazing job getting all of this content up on the website after the show is over. A big shout out to our producer, Jeff. We'll get him on Zoom tomorrow. Jeff doing an amazing job. Our Zoom producer, yes, we have a separate Zoom producer. It's Larry. And thanks to all the other folks at Motown Digital, a bunch of people making this broadcast happen. Have a great day. We will see you tomorrow right here on the Megacast.